I'm Dr. Anthony Kaveh, an anesthesiologist and an integrative medicine specialist, and every week I have multiple patients who are Gen Z, high functioning, really smart, but also terrified of surgery in this operating room like the one that we're in right now. And I want to share with you the 3 tips that can help them thrive through surgery and crush their fear. And these same tips can actually be used for any stressful situation, including what I'm going to do with this syringe connected to the monitor in a couple of minutes. So this is live after a long day in the operating room. I appreciate all your support as I do these for you. And please feel free to fast forward to the 3 parts if there's one of these 3 that resonates most with you. Those 3 are going to be the diet and the supplements that can help promote your body to heal through surgery faster, to give you the confidence that you're going to wake up with less pain, less nausea, etc., and heal faster. The second will be how to overcome the marijuana and alcohol and other substance use that Gen Z is particularly susceptible to with other supplements, to replace those before surgery. And then lastly is going to be the mindset and the psychiatric care that Gen Z is also more open to, and ultimately the holistic treatments that, unlike boomers and some older millennials and Gen X, Gen Z is very open to comparatively. And specifically, you got to remember that Gen Z is different than other generations because they've grown up in their formative years with things like pandemics, post 9/11, etc., that other generations did not grow up with. And in particular, they are faced with the loneliness epidemic at a younger age than any other generation. They are less likely to use alcohol and more likely to go for other plant-based therapies like cannabis or marijuana products. So that is changing. They're more likely to reach for sleep aids. And they also have this digital distraction mania that affects them more than any other generation. So these 3 tips are specifically geared toward Gen Z, but anyone can benefit from them. Donna, thank you for the kind super thanks. So first off is diet. Remember that diet is crucial to how your body is going to heal after surgery. And so many Gen Z patients are terrified of waking up in pain or being in pain for weeks on end after surgery. So what are the supplements and the foods that can ultimately help your body heal faster? Well, we know a couple of them. Remember, this is not medical advice. You need to speak with your doctor before starting any supplements, and most importantly, before surgery, it's recommended to hold all supplements, often for 2 weeks, to reduce the risk of any interactions that might cause bleeding or anesthesia interactions when you're having surgery. So these are supplements that you can certainly supplement with after surgery, but you want to get the whole food sources before surgery to avoid having to go for the concentrated capsule form. This includes magnesium, zinc, vitamin C, vitamin D. You can get these from so many whole food sources, and you want to make sure you're getting enough glutamine from a whole food protein source. Gen Z is, in my experience, far more likely to grab for powdered foods. In San Francisco, where I practice, we have all sorts of like powdered alternative foods, Soylent, Ample, etc. I'm not saying they're all bad necessarily, but they may not have the same benefits as a whole food source of that glutamate-containing protein source. We know that glutamine is necessary for wound healing. Glutamate's a neurotransmitter, Glutamine is what we want to make sure we're getting enough of. Because the faster your wounds can heal, the less pain you're going to be in for that duration of time because your body is on its healing after surgery. So I would put aside the processed food, like prepackaged food, certainly. You want to make sure you're getting turmeric and ginger in whole food sources because those can also help prime your body to have less nausea after surgery. And so many Gen Zers are prone to nausea for any number of reasons. In general, younger people are more likely to be nauseous from anesthesia than older people. So don't go for the ginger or turmeric supplements. Add them to your food to minimize the risk of the bleeding and anesthesia interactions. Number 2 is marijuana. Now, in many other videos, I've talked about marijuana and how it can interact with anesthesia poorly. It can cause more pain in some individuals after surgery, more nausea after surgery. It can lead to all sorts of other side effects in your heart and lungs. We're not going to go into them in this video, but it's always beneficial to stop for at least 4 weeks, because especially in chronic marijuana users, we know that the lipophilic cannabis, or the cannabinoids, will hang around the body for a long time. They will increase anesthesia requirements, and the more anesthesia that you need, the higher the risk of side effects. Possibly the higher risk of remembering something, of developing PTSD down the line. I'm not saying marijuana is bad or cannabis does not play a role medicinally. It absolutely does. But you want to make sure that before surgery, you're being mindful and safe about how you're using any cannabinoids. Same with alcohol. Same with nicotine and cigarettes. You want to stop those for at least 4 to 6 weeks, because of the bleeding interactions, the poor wound healing, the more pain you're going to have potentially for longer after surgery, not to mention unsightly scars, etc. So you want to replace these with something else. Now, there are so many alternatives for reducing stress, if that's why one's using marijuana, or anxiety, or even pain. I like to use essential oils in the form of aromatherapy, because those are typically safe before surgery. Once again, talk to your surgeon, make sure that everyone's on board, but lavender, ylang-ylang, orange or citrus, ginger have good evidence for not only reducing anxiety, but also reducing nausea after surgery without the risk of those side effects the way that marijuana does. Now, that's probably not going to be the same as smoking a joint. I'm not saying it is in terms of anxiety reduction, but you can pair that with acupuncture, because we know Gen Z is more open to holistic views of medicine, including acupuncture or acupressure. Melatonin is powerful. I actually give melatonin orally to some patients when they're in the pre-op area, because it can reduce anesthesia requirements. It can have all sorts of positive effects in the right patient at the right time. You want to talk to your doctor. But even after surgery, melatonin does have various anti-inflammatory effects and can help promote sleep that is inherently disrupted from all anesthetics. REM sleep disruption is very real, from whether it's the gas coming out of the ventilator next to me or IV anesthesia. Melatonin may help restore circadian rhythm faster to promote healing afterwards, especially in those that use marijuana to help sleep. I'm not saying it's wrong to use it in certain contexts, but after surgery and before surgery in particular, you gotta be mindful of that. Now, breathing exercises, that's actually why I have the empty syringe here, because breathing exercises are so powerful to help augment all these together. Like I said, if you get a 30% THC joint, it's not gonna, melatonin ain't gonna be the same as that. Valerian root, magnesium, these aren't gonna be the same level of intensity. It's when you combine in a holistic way the diet we mentioned earlier, and essential oils, aromatherapy, if that's what works for you, and acupuncture, etc. And breathing is one of the most powerful ways to be able to bring it all together to begin to have effects that are long-lasting and possibly on par with the effectiveness of certain plants for anxiety reduction and sleep. So I'm going to connect myself to the pulse oximeter here on this life support monitor so you can see in my heart just how breathing with the Valsalva maneuver with this syringe can make a dramatic impact on my physiology. And we know that our physiology will in turn impact how we feel. So while I'm getting this all ready here, if you appreciate me coming on here after a long day in the operating room, I really appreciate it if you share these tips with others. And if you hit a like and share with your loved ones before surgery, because your support helps me do this more often. And you're going to hear my heart rate. I understand it can be triggering in some individuals. I apologize if it is. You can fast forward if it's bothering you. I'm going to do a Valsalva maneuver where I try to blow out against a closed glottis. AKA, it's like you're having a bowel movement on the toilet. I use a 10 cc syringe to emulate the type of pressure that you want to be generating. Because when I try to blow out the end of the syringe here, it's a lot of pressure that I need to blow against, and that will actually lower your heart rate. I find it very powerful to reset your heart rate, stimulate your vagus nerve if your heart's racing because you're anxious. I do it with many of my patients on this operating room table next to me if they're very anxious before surgery and I can't yet give them sedative medications like propofol or Versed. And just so you know, my trick always for doing the EKG leads is white right and smoke over fire. So white goes on the right here. I try to avoid the hairs because no one wants to get waxed before surgery. Smoke refers to the black lead. Goes on the left side. White right, and smoke over fire, because black is the smoke over the red one, which I'm going to put a little bit lower down so you can hear my heart rate finally. I can't move around too much. I'm going to raise the noise on here. As I inhale, watch what happens. Okay. So, hey, none of your business, I see you on there. Shout out to you. So you heard my heart rate go up as I inhaled. Now when I exhale, listen to my heart rate go down, and then I'll do it against the syringe to emulate a Valsalva. All right, did you hear the difference there? Hey, Susan Lombardo, good to see you. I'm gonna do it one more time. You can hear my breathing rate as my heart rate changes. So if you look at the lines, you can hear it changing. As I inhale, it goes up. As I exhale, it goes down. Now, if you guys look at this, if you guys look at the green lines, you'll see that it expands, right? The R interval increases, my heart rate variability is going through the roof. You signal it's not cooperating with us. But you can tell that at least I have a heart, right? Give me some hearts here. When you're combining melatonin or acupuncture or essential oils, you can begin to overcome the marijuana alcohol effect dependencies before surgery. Let's move on to number 3, and that's the mindset and the digital distractions that Gen Z faces more than any other generation. Obviously because they're digital nomads. They grew up with iPhones before you and I ever had, cable internet, right? Distractions are very powerful before surgery. Before I place an IV, I always ask my patients to cough, because a very strong cough will gather up all the muscles in your throat so that you're focusing on those muscles and you don't feel the prick of the needle as much. So distractions are good. However, Gen Z, I find, gets distracted from the point of surgery in the first place sometimes. So instead of focusing on how they're going to recover after surgery, in a time when they're vulnerable to loneliness, vulnerable to poor nutrition because they're probably not going to be cooking for themselves, they get distracted with social media. I see it in my patients that are on their phones Instagramming while I'm trying to do a nerve block, or while I'm trying to place an IV, or while I'm trying to explain the anesthesia plan to them. Nothing wrong with Instagramming, but you got to focus on the task at hand. I think everyone would agree with that in a compassionate way, of course. So when patients are not focusing on their long-term recovery after surgery, it raises the concern that they're going to miss out on valuable healing due to that distraction. And this is where guided imagery, music therapy, it sounds like trivial, but I've seen it transform anxious patients that are obsessed with the phone in pre-op, begin to put their phone away and get into the right mindset before they fall asleep. And that mindset is so critical to how you wake up. I really can't stress it enough. I had a patient just this week who I thought was going to wake up yelling and screaming, but they were in such a Zen Jedi mode before they fell asleep. They woke up grimacing and they said, "Whoa, that was amazing." I was so shocked, but it just, to me, enforced just how heavily the positive mindset before falling asleep, not being distracted and suppressing fear with the smartphone or social media, but being able to focus on it and try to embrace it with curiosity. Now, in addition to guided imagery and music therapy, having a plan, a social plan with your friends and family is so important, because loneliness will only get worse after surgery. And so many of my Gen Z patients don't think about this. It's not their fault, they just haven't had surgery before. They're younger, they haven't needed to have operations as much as boomers or Gen X. So if you're lonely before surgery, after surgery, if you're on crutches, if you're not eating, if you have a tube coming out of your stomach or out of your kidneys, or if you can't speak because you had surgery somewhere in your throat, your loneliness is only going to get more challenging. And we know that loneliness is so critical to healing. I mean, addressing loneliness is critical to healing. Cindy, thank you for that super thanks. And I missed someone else's super thanks. Lynn, thank you so much. And Victoria, so much appreciated. So if you don't have a plan a couple of days or weeks before your surgery for who's going to bring you food, whole food, not processed garbage, but stuff that you're getting enough calcium, magnesium, zinc, vitamin C and D, getting enough glutamine, getting your ginger and turmeric, you're not going to be cooking it on your own. Imagine if you had a wrist fracture. Who's cooking? You're not cooking for yourself. But this is why you need to have a plan ahead of time. And with your psychiatrist or your therapist, you need to have a plan ahead of time so that everyone is on board with your medications being optimized, if you take medications like SSRIs or TCAs or benzos, or if you don't take medications, so that your therapist knows when they're going to meet with you after your surgery, because the risk of post-op depression and anxiety might be higher in Gen Z because they're more open to getting diagnosed in the first place. So they have care established before, but 1 in 10 of my patients, if even, have even mentioned this to their therapist. That, yeah, I'm getting surgery. I don't want to be more depressed after. I don't want to have a panic attack when I get home. So you got to not just focus on the cell phone in the pre-op area, but make sure you have your care team rooting for you when you get home. And that is how you can address Gen Z's vulnerability and susceptibility to distraction from smartphones. I find it's helped so many of my patients, and I hope that if you are if you know someone who's having surgery, Gen Z or not, you share these tips with them. Maybe when we have a better monitor, I can do a better demo with you on how you can also incorporate the breathing to augment everything we talked about, all those other strategies as well. I appreciate your support. Once again, hit that like button, subscribe to keep up with all my lives. And now I'm going to answer 5 of your questions before we sign off. And Darian, you're so welcome. Anthony Brown is saying, straight talk, me too, and paralysis. I don't follow that question. Sorry, Anthony. Abigail says, I'm a lonely Gen Z. I've had 12 surgeries. It's a good thing that I have a very strong faith to help me through everything. And Abigail, faith, time and time again, is shown in many studies, often through the sense of community that it provides, to be a very protective factor against numerous mental health conditions, in particular addiction. Darian, good to see you. And Herbal Sunshine says, I had a rainbow baby via C-section, did a lot of what you said, and I did amazing. They had a lot of medicine already out for me. They had expected me to have a panic attack. I needed nothing extra. Herbal Sunshine, I hope you can inspire others with that story. All right, 4 more questions. Incognito, I will watch this one again so I can go over what to eat. And yes, I have a neglected malunion distal radius to get fixed. I'm wishing you the best, Incognito. Courtney Frazier, good to see you. Question 2, I have epilepsy, anti-anxiety, antidepressant, and ADHD meds. How do those affect anesthesia? Some epilepsy meds affect the duration of action of paralyzing agents like rocuronium. I can show you right now, actually, which ones those are. Some medications need higher doses based on certain stimulating medications like Adderall, or on certain anti-anxiety medications. So here is our here are our drugs. Rocuronium is one of our paralyzing agents. You actually see it says paralyzing agent there on top. Propofol requirements are higher in some patients that take other anti-anxiety medications. Certainly opioids are going to be dosed higher if one that has chronic pain and is taking medications for that? Very good question. And I am totally tethered by the EKG here, so there we go. Let's get back in position. Question number 3. My nephew is Gen Z. He's had several surgeries in his 26 years of life. His form of relaxation pre-op is to sing or listen to music. He's even calmed others down with his singing. And I can't pronounce your name, Lover. That's why music therapy, does not matter what kind of music it is incredibly powerful, especially when paired with aromatherapy and breathing to relax oneself before surgery and the patients around them. It's incredible. I've seen it time and time again. Okay, Linda Dove says, why emergency more scary? So Linda's question about emergency surgeries are always higher risk because patients have full stomachs. And when you have a full stomach, you're at risk of aspirating, meaning vomiting, and it goes into your lungs and burns your lungs. It can be fatal. That's why we always have a suction device. Check it out here. Every anesthesiologist has a suction catheter right next to them. And that's this thing right here connected to a Yankauer. You see this here? We keep it in the machine so it's not always making a sucking sound, but we always have to have a suction device nearby, right here, so that we can suck stomach acid contents out, call it gastric contents out before it goes in the lungs. And anyways, if it's an elective surgery, you've been fasting, hopefully you didn't cheat, but if it's an emergency surgery, you're at risk of aspirating. Very good question. Question 4, Darian asks, do my feet smell? It's been like 12 hours in the operating room, so maybe they do. And last question, Herbal Sunshine, hypothyroidism. Hey, hypothyroidism does have some theoretical interactions with anesthesia. Mostly you need to make sure that the volume status is correct, the electrolytes are correctly maintained, you don't have low sodium levels, etc. And you need to make sure that the medications that are being used to treat the hypothyroidism are not overdosed, because those can affect the heart, can lead to arrhythmias, etc. Typically, well-managed hypothyroidism is not a concern for anesthesia. Very, very good question. I need to end with Rich, though, because Rich is going in for heart surgery tomorrow, is getting a cardiac resynchronization therapy device. I'm wishing you the best, Rich, and I hope everyone here sends you positive vibes for your CRT placement tomorrow. Wishing you the best. Oh, Victoria, thank you for that super thanks again. Says, kind of surprised mobile phones are permitted in an OR. Modern cell phones might interfere with medical equipment. Sounds unlikely, but I'm a cyber privacy. Okay, well, that's a very reasonable concern. Does not appear to bear out in the practice that I've seen, but it's a very good concern. Thank you for asking that. There are many other reasons why cell phones should not be allowed into the operating by patients, particular for other privacy reasons, but interference with basic monitors does not appear to be one of them. However, there are more advanced monitors that they might interfere with, just like in airplanes, right? Very, very good question. Hey, I appreciate everyone's love and support here. Please send Rich positive energy for his surgery tomorrow. And until next time, remember that you have more power over your health than you've ever been told.